washing my hands. Hello, my name's Nicole. I'm going to be your nurse practitioner student today. Hi, what's your name?
Bethany.
Bethany. What's your last name?
Lee.
Awesome. What's your date of birth?
2/16/95.
Okay, great. A couple silly questions for you. Where are you?
At a hospital.
What time is it?
Around 7:30.
And what's the date?
December 2nd.
And why are you here?
Just for general assessment.
Great. I know silly questions, just checking your that you are alert and oriented times 4. Okay, great. Let's go ahead and get started by just checking your vital signs. Normal, very good. Go ahead and check your blood pressure next. If I could have this arm for a moment, please. Okay, great. I'm going to squeeze it here. It won't be too long. Alright, normal, 117/65. Thank you. And then we're going to go ahead and check your heart rate here next. Great, normal heart rate of 72 and about 18 respirations, which is normal. Alright, let's get started with the exam, shall we? I'm going to first just start on your head and your scalp. So I'm just looking to see if there are any skin problems or lesions. Doesn't appear so at all. I'm going to palpate your skull. I don't see any dryness. Like that. Okay, great. Your face looks very symmetrical to me. I'm going to have you make a couple of silly faces. So smile, frown, stick your tongue out. Alright, very good. Shows me some of your cranial nerves are intact. We'll go ahead and look at your ears next. Just palpate that external ear of the pinna, which is normal. No lesions, skin is intact. Any problems with your ears?
No.
No? Okay. Great. Let's take a look inside your ears. Alright, your tympanic membrane, which is your eardrum, is nice and pinkish gray in color. It's not bulging at all. And just have a minimal amount of wax in here. Thing over here, which is good and normal. Alright. We're going to do a whisper test to check your hearing, another cranial nerve. So just repeat what I say.
Merry Christmas. Flower pot.
Okay, great. Let me know where you hear this, in the middle, on one side or the other.
Towards the middle.
Okay, awesome. And then we're going to do each ear separately. This is the Ryan test. Do you hear this? Hear that? Great. Good air conduction. What about here when I touch your tongue?
Yep.
great. The cranial nerve that controls your hearing is also intact. So let's go ahead and move on to your eyes. Let's see, they look great. Start out, let's check your vision. So this is the Snellen eye chart handheld version. I'm going to hold it about 6 feet away from you. You've got your contacts in?
Yes.
Okay. So here's about 6 feet. And cover your left eye for me and read the lowest letter that you can.
D-E-F-P-O-T-E-C.
Awesome. 20/20 vision, and do that other eye for me.
D-E-F-P-O-T-E-C.
Great. I'm going to take a look at your external eye here, so I'm just going to pull your eyelids down and look up. Sclera is nice and white, and your conjunctiva is pink and moist, no pallor noted. Okay, great. Let's take a look at your internal eye. And to do this, I am going to turn the lights down. My ophthalmoscope set at 0, and just look straight ahead at the wall for me. Nice normal red reflex. I don't see any problems with your cornea. Do the same thing over here. Look straight ahead for me. Nice normal red reflex. I don't see any problems here either. Okay, great. Oh yeah, thank you for reminding me to put the light back on. Okay. All right. I'm gonna check your 6 cardinal keys. So just follow my finger here. Great. Awesome. Keep following. Nice and symmetrical. Very good. Again, all the cranial nerves I've tested so far are intact. Check your pupillary reflex. So look straight ahead at that wall for me one more time. I just want to make sure that your pupils do the right thing when I shine a light at them. Great. Constrict equally. They're equally reactive. Very good. Alright, let's move on to your nose. I'm just going to palpate your nose. It's nice and midline. I don't see any drainage. That septum is right in the middle. Push on some sinuses here and let me know if you feel any pain. Any pain? No. Okay, good. Go ahead and cover your right nostril and take a breath. In through your nose and out through your mouth, and do that same thing on the other side. Alright, both nares are patent. I'm going to just take a look inside your nose briefly. Just tip your head back a little bit. Don't see any polyps or discharge. Everything looks good and normal. Alright, let's move on to your mouth. Symmetrical pink mucous membranes of your lips. Go ahead and open your mouth for me. I'm going to use this to push your tongue down. Stick your tongue out a little bit. Let me get my light and I'll see a little bit better here. Alright, stick your tongue out a little bit. Say ah. Great, that uvula goes up, and open your mouth again. I'm going to look at your cheeks. Everything's nice and pink. Stick that tongue up so I can look underneath. Good. teeth look really good. And you see a dentist regularly?
Mm-hmm.
Great. Just that biannual checkup and cleaning.
Yeah.
Yep. Cool. All right. That looks great. So I'm gonna go ahead and take a look at your neck next. So looking at all your skin here, looks nice and intact. I don't see any lesions or scrapes or bumps or bruises. Sorry, my hands are cold. I'm gonna palpate all over your neck. Trachea is nice and midline, and your thyroid is normal size for your gender and age. Everything's feeling and looking really good. I'm going to check all your specific lymph node areas here around your neck. So preauricular, postauricular, submental, submandibular, occipital, stereocervical, cervical chain, and then shrug your shoulders, and supraclavicular. You didn't feel any enlarged lymph nodes, which is great. So let's go ahead and feel your carotid pulse on each side. So nice and strong, 2+, which is a normal, regular rate and a regular rhythm. Something over here. 2+ strength, regular rate, and regular rhythm. Great, I'm going to listen the bell of my stethoscope to your carotid arteries. So go ahead and take a deep breath in for me and hold it. All right, and exhale. And take a deep breath in, hold it, and exhale. Sounds great. I didn't hear any bruise, that swishing noise that we worry about, so none of that. All right, very good. Let's go ahead and take a look at your heart next. So I'm just going to feel your chest and see where that point of maximal impulse is. Right. Feel your heart the most, which is this normal point, the 5th intercostal space, mid-clavicular line. That's normal. And listen to all of your heart sounds. So aortic, harmonic, tricuspid, and mitral. Awesome. One more time with the bell of my stethoscope. So aortic, harmonic, tricuspid, mitral. Awesome. I just heard regular S1 and S2, no extra heart sound, murmurs, or palps, all normal there. I'm going to go ahead and take a look at your chest and then listen to your lung fields here. So again, I don't see any problems with your skin. Just one mole back here and a birthmark that look very normal. Let's listen to all of your lung sounds. So every time my stethoscope touches your skin, just take a deep breath in and out for me. Awesome. Lift this arm for me. Great. Come around to the other side here. And lift this arm for me. Deep breath. lean forward for me? Are you doing okay?
Yeah.
Okay. Deep breath. Everything sounds really clear. Actually, could you turn my way so the camera can see me doing your back? Okay. So I did these two and this one. And go with me. Alright, go ahead and relax. Your lungs sound really good, nice and clear. Go ahead and lean forward for me. Take a deep breath. One more time for the camera here, actually. If you could, yeah, right there would be great. Just gonna check for your thoracic expansion. So take a deep breath in and exhale. Great, and my fingers moved symmetrically, which is great. And go ahead and relax it however you're comfortable. Alright, that concludes the lung assessment. I'm going to go ahead and have you lean back and I'm going to look at your belly. You want to pull your shirt up? Any pain in your belly at all?
Nope.
So, skin looks great, intact. One little mole there. Nothing abnormal. So I'm going to go ahead and listen first, and then I'll touch your belly and make sure it all feels good after that. I already heard active bowel sounds, which is great. If I wasn't hearing bowel sounds, I would listen up to 5 minutes to make sure I heard some and then classify them accordingly. Nice and active. All right, I'm going to go ahead and listen to your aorta. I don't hear any bruise. Your renal arteries. And your iliac arteries. Great. No bruise. First, I'll just lightly palpate your belly. Let me know if you feel any tenderness at all. Doing just fine on time here. Any tenderness?
Nope.
Okay, great. I'm gonna push a little harder and make sure I don't feel any masses or lumps. So just try your best to relax. Are you okay? Am I tickling you?
Yes.
Okay. No hepatosplenomegaly, so that is great. Awesome, thank you. All right, let's take a look at those extremities. So, bend your arms for me and pull against my hands and push. Great. All right, and I'm gonna feel your radial pulses. Which are equal to plus in strength, regular in rate and rhythm. Temperature of both arms is warm, and your skin is dry. Let's check some reflexes. So bicep. Try to relax your arm if you can. I feel that tendon move. Great. Hold your arm like that. Great. Triceps. Just try to relax your arm. Okay. Intact and normal. Gonna look at your legs here. But before I do that, let's just double check your capillary refill on your fingers, which looks nice and brisk. Within 3 seconds, tells me you have good perfusion. All right. Your skin is dry. A little bit of a scab there. Do you know what happened?
I've just been cutting shaving.
Oh, okay. Looks like it's healing okay for you. Okay. Take your socks off here. Go ahead and pull against my hands and push. Great. I'm going to check that capillary refill. All down here. And I hardly, but a little bit, see your scar from your surgery that I saw in your medical history. I don't see much of that scar left at all. Looks good. I already did the push and pull. Let's check the rest of your reflexes. So just relax your leg into my hand. This is your patellar reflex. Really good one there. And just relax. Alright. Great. And bend your knee for me. And this is your flex back here. That is intact. And while I'm down here, I'm going to go ahead and feel your pedal pulses, which are 2 plus in strength, regular, and right and rhythm. Okay, awesome. Only reflex that we have left is the Babinski out. Take your socks back off one more time here. Alright. Sorry if you're ticklish. There you go. I saw the toes curl, so that's normal. All right. Before we do the rest of your neurological assessment, I'm going to tell you 3 words and have you repeat them here in about 3 minutes to check your memory. So let's go with mountains, puppies, and sunshine.
Okay.
All right. Step out of bed for me. Is it too high for you? Good. Okay. Face this way and close your eyes. Just checking your Romberg test. You stay nice and still, which is great. Go ahead and open your eyes. And then put your arms out like this for me, palms up, and close your eyes. Alright, this is checking for any pronator drift, which you don't have, which is normal. So go ahead and relax. Alright, go ahead and take a couple steps this way for me. I just want to look at your gait. Looks normal. And then walk back this way, heel to toe. Awesome. Very good. And then let's turn around and do some abduction and adduction. So abduct your right leg for me, and abduct, and same thing, out and in. Pull a knee up, and the other knee. Great. Everything looks really good. You can have a seat again. A couple other range of motion joints we haven't checked yet. Your neck, I'm going to roll it in a big circle for me. Good, looks great. And do each arm for me. Awesome. Looking good. Alright, now we're just going to do a test. You go ahead and close your eyes, and whenever you feel that, let me just say now.
Now. Now. Now. Now. Now. Now. Now. Now. Now. Now. Now. Now.
Okay, great. Open your eyes. So this is the dull and this is the sharp. Make sense?
Mm-hmm.
Let me know which one you feel.
Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp.
Alright, open your eyes. Looks great. Your proprioception is normal. What were those 3 words I told you to remember?
Mountain, puppy, and sunshine.
Great. 3 things I love very much. Alright.